Again, my name is Amy Stopford, and I recently graduated from a master's program here. So today I'll be presenting my thesis that I defended, which is the effect of commercial sanitary pad use on school attendance and health of adolescents in Western Kenya. So just to provide a little background to my project, over the past few decades, there's been significant attention devoted to researching women's education and improvements in women's education because it's associated with health benefits and also economic development in impoverished nations. And one possible intervention that's been brought up for improving women's educational attainment is the provision of sanitary materials. It's thought that lack of affordable access to sanitary materials may keep girls and women out of school and work because they don't want to go into these public arenas when they have a menstrual leak. So there have been no published studies in Kenya on the relationship between commercial sanitary pad use and school attendance, but many NGOs have already given girls in Kenya, have provided them with sanitary pads, and have also begun researching innovative materials that they can use to make sanitary pads out of. So, and then there have been some mixed conclusions from there's only 2 published studies on the relationship between commercial sanitary pad use and school attendance. One saying that they do increase school attendance, the provision increases school attendance among girls, and the other pointing to the opposite. So this summer I spent 3 months in Uhuru Bay, Kenya, doing my field work. Uhuru Bay is located on the western side of Kenya, as you can see, really close to the Tanzanian border and right along the shore of Lake Victoria. It's one of the poorest areas in all of Kenya, and families in Uhuru Bay largely rely on subsistence farming and fishing for their livelihoods. So the educational attainment of females is also quite poor in Nyanza province, where Uhuru Bay is located in Uhuru Bay. Around 50% have completed only part of primary school, and 13.4% have had no education at all. And then this is a significant number. 7.3% have self-reported symptoms of vaginal infections. That becomes significant because I also looked at the prevalence of vaginal infections in girls in my survey and compared it using whether they were using sanitary pads or another material and whether this increased their prevalence or decreased it. So there's also a very high prevalence of HIV in Uhuru Bay and Nyanza province. The most recent estimate of 13.4% in Nyanza, and it's believed that communities located along Lake Victoria are at particularly high risk because of a trade called fish for sex, where women prostitute themselves in order to gain fish to sell in the marketplace. So this idea of transactional sex being prevalent in this area is very much present. Okay. And then the girls, I guess this is a history of primary education in Kenya. In 2003, it was estimated that only 54% of girls in sub-Saharan Africa do not complete primary school, and that 17% are only 17% are enrolled in high school, which is quite low. So this is why I wanted to look at primary school girls, because it's that intersect between primary and secondary where you see a huge dropout in schoolgirls. And then in 2003, to combat this huge dropout rate, the Kenyan government instituted a policy of free primary education for all children. And they did this because they believed that paying direct school fees was a major obstacle in students attending school. Families just couldn't afford these fees. However, since then, there's still been quite a large dropout rate. So it makes you think that there's something else at play. I think the reality is, at least what I found when I was doing my field research, is that primary education still isn't free for many of these families. They're having to pay indirect fees, such as books, uniforms, and then teacher salaries. So these are some of the benefits of improving women's education, some of the health benefits. I don't really need to read through all of them, but it's associated with health and nutrition, knowledge of HIV facts, decreased risk of HIV, and really the health of a woman's child also. So it's most commonly reported that girls miss up to 4 days of school per month due to menstruation and a lack of affordable sanitary materials. These are advertisements taken from an NGO website that works in Rwanda, and as you can see, I'll read out a little bit of one, but they really portray the story as being that women are missing work because of not having affordable access to sanitary pads, and girls are missing school. In this letter, it just says, it's a letter to the president, so Obama, and it says, maybe you find it offensive that we mailed you a sanitary pad. We think it's even more offensive that millions of women in developing countries miss 50 days of work or school per year because they do not have access to affordable sanitary pads. As a result, their families, villages, and countries remain, I think it's kept in poverty, basically. Affordable sanitary pads are essential to the prosperity of the developing world. And then they have a picture of a sanitary pad and says, this is a human right. So the reports are largely from NGOs and news agencies, and there really hasn't been much research on whether it's actually the case that girls are missing a lot of school because they don't have sanitary pads to use. So there's only been 2 studies worldwide on the issue to date, and then of course my own now is included. So one is what took place in Ghana, and they found that the provision of sanitary materials and pads in this case actually reduced absenteeism in girls. And then the other from Nepal found that the provision of a menstrual cup, so that's a cup that you actually insert into your vagina, had no effect on school attendance. So. And then there's also a paucity of research on the relationship between sanitary materials and the prevalence of vaginal infections. There's been 2 studies from India that have kind of hinted at a relationship, but it wasn't, they didn't actually study whether it was sanitary pads that were increasing the prevalence of vaginal infections. We do know that girls in sub-Saharan Africa often use unhygienic materials when they don't have sanitary pads to use. So they'll use rags, leaves, or newspapers. And that's something I found in my work. A lot of girls mentioned they cut up pieces of old mattress and put it in their underwear. Or you'll see that an answer choice for my survey for what you use to control your period. One is many underwear or multiple underwear. So they use, if they have underwear to use, they'll just wear 3 pairs of underwear, which isn't necessarily unhygienic. But, and then we also know that vaginal infections are a risk factor for HIV, which certainly is important in this setting because the HIV prevalence is so high.
Can I ask a question?
Yeah, go for it. Yeah.
And maybe you'll get to this, but how did you come up with your survey question responses? Like, how did you know that they would wear 3 layers of
Yeah, it will come to that,
okay.
But it's okay. So before I did my survey, I held focus groups, and I used the focus group to answer the responses that girls gave to inform my survey. So I asked girls, what do you use when you have your period? And a lot of them said many underwear, and some said mattresses, tissues. There's some said nothing at all. So. And then my study was really born out of Weiser, which is located in Megurube. It's a pre-secondary school for girls, and that's where I stayed while I was there, and the work of Cheryl Broverman. She actually presented the idea of the study to me, saying that she'd heard many anecdotes of girls missing school and also engaging in transactional sex to pay for hygienic products such as sanitary pads. And then Amy Stopford, who was a postdoc at Duke recently, also did research, and she has unpublished data that 50% of sexually active girls in Mahuru Bay engage in transactional sex to pay for hygiene products, which include sanitary pads. It's not just sanitary pads.
Did you notice that there was a difference in absenteeism when girls went to co-ed schools versus single-sex schools for period of time?
No, I mean, all the schools that I worked with were co-ed, so I didn't look at that, but I would think that it would be more of an issue at just my guess offhand would it would be more of an issue at co-ed schools because of the teasing that girls that reported from boys about their menstruation, but I'm not sure. Yeah. So that's a good question. So these are my study objectives. There's pretty much 3 objectives that I had. The first was to look at the relationship between commercial sanitary pad use and school attendance, as I said. And the second was to investigate the relationship between sanitary pad use and prevalence of vaginal infections. And then I was also interested in my focus groups about just seeing the whole picture of how the positives and negatives that girls find living in Mahuru Bay and what's their daily experience like, and especially in dealing with their menstruation. So I got some interesting data and major themes from that in my fall fieldwork. My hypotheses were that commercial sanitary pad use would be associated with an increase in school attendance and associated with a decrease in vaginal infections. And then, so my study was a mixed method study, so that means both qualitative work and quantitative work. So I had a qualitative focus groups and quantitative survey. And it was also had an exploratory sequential design. So basically all that means is that I was exploring things through my focus group and using that to inform the answer choices of my questions in my survey. So, and that's part of my research team. I had 9 women from Mahuru Bay who were working with me, and then 3 Duke undergraduates. So not all of them were there, but it was a large team. Okay, so as I mentioned before, I first had qualitative focus groups with girls in school. So there were a total of 6 groups, 31 girls total split among the groups. And I used that to inform my survey and also to collect narrative about the experience of girls dealing with their menstruation. And then we also did 2 focus groups with girls who had dropped out of school. We did this actually after the survey, though. We weren't planning to do it in the interest of time, and then we had a little extra time, so we thought we'd include it, especially since it might have been the case that girls who dropped out were ones who were having the most problems with their menstruation, if that was the reason that they dropped out. And then following the focus groups, we conducted a quantitative survey. So 9 women actually went around. It was done in Duluo, which is the local language there, and we interviewed a total of 482 girls, ages 11 through 18. 321 of these were in school, and 151 had already dropped out of school. So we identified the 151 by basically going to each school and asking the students there if they knew a girl who dropped out, and then asking girls who dropped out if they knew somebody who dropped out, so, which is called snowballing point, which we'll talk about too. So as I said before, the survey was conducted in the local language, which is Duluo, so it had to be translated to that. And that was done by actually 4 different translators, which was perhaps a bit too much, but it definitely I made sure that it was translated correctly. And then it was back translated to English. And then I used the qualitative data to inform the quantitative survey. We piloted the survey on 4 girls in school. It was a pretty short piloting a period, but that's all we could afford at that moment. The inclusion criteria was that girls be between the ages of 10 to 18 and that they have already have reached menarche. So we randomly sampled from the 14 local primary schools, which was completely saturated. So those were all the primary schools within the area, and we did that through school rosters. And then we used snowball sampling to identify girls who had dropped out of school, which is basically just asking people if they knew somebody who dropped out. So that was the only way we could do that because it was just a very hard population to find the sample for. So, and then for the data analysis, we used applied thematic analysis for the qualitative data. So it's just where you're identifying themes by, in my case, we had 2 separate coders identifying themes and comparing the themes, and then logistic regression to analyze the relationships between commercial sanitary pad use and school attendance and prevalence of vaginal infections. And then I obtained some consent for the girls in school from head teachers and out of school from their parents. So these are the variables, all the variables that I looked at. I've gone over a lot of them, but the outcomes, again, are school attendance and symptoms of vaginal infections. School attendance, I analyzed in 3 different ways. So it's a continuous variable. So the girls will say they miss 1, 2, 3, 4, 5 days of school. In order to analyze it, the simplest way is to dichotomize it. So girls either missed school or they didn't. So the first way I dichotomized it, I said, if a girl has missed more than 1 day of school or more, she's missed school. If she's missed 0 days, she hasn't. And then the second way I did it was if a girl's missed 3 or more days, she's missed, and 2 or less, she hasn't. So I did it that way to simplify it, but dichotomization, you also lose information through that process. So I split it up in different ways to see if that made any difference.
3 or more days, what was the time period?
In a 2-month period, yeah, good question. Yeah, it's in a 2-month period. So
I have a question too. Were the girls still in school when you got to Kenya?
when I got to Kenya,
Like
yeah.
for 2 months, like were they in school the duration?
And then the exposure variables that I looked at, of course, were sanitary pad use. And then I also had kind of a category of other use or non-use. And that include reusable pads, many underwear, multiple pairs of underwear, handmade materials, which would include rags or mattresses, and then using nothing at all. And then in analysis, there were 4 confounders of the relationships that I looked at, which were age, sexual activity, which was only if a girl had ever had sex, it wasn't frequency of sex, maternal education, and then ever being pregnant. So what I found in my qualitative results is that the experience of girls menstruating in school is largely negative. They experience a lot of shame and deep embarrassment when they're menstruating in school, particularly because of menstrual leaks that they have quite often when they're not using sanitary pads or an absorbent material. A lot of girls mentioned that they were teased by boys, either because of a menstrual leak that the boys could see or because boys could smell them. They talked about boys having a keen awareness about their menstruation. So that was a quote from one of my focus groups. A girl said, "These boys are very much aware of our periods." I could hear them say, "Someone is smelling." The embarrassment associated with menstrual leaks also leads to a lot of non-participation in classes. Girls you have to stand up to answer a question in classes, and they won't stand up if they fear they have a menstrual leak. And then when everyone's leaving class, if they think they might have a menstrual leak, they'll wait until everybody's left and then leave because of fear of teasing. Also in sports, if they're wearing a rag, they worry that it will fall out when they're playing sports because it's not, there's no adhesive. And then they also talked about not being able to concentrate well in classes due to both menstrual pain, which was a big theme, and then also worry over possible menstrual leaks. And girls commented in the focus groups that they do experience a lot of menstrual pain and they don't know what to do to control it. And it was one of the major findings in the quantitative survey also. Girls said that actually the greatest challenge, most girls said the greatest challenge they had during menstruation was menstrual cramps. So it wasn't not having sanitary pads to use, although that was the second most common. Didn't mean to go there. And then girls also said they would miss lessons to go home and change and bathe, which I thought was interesting. Teachers would actually encourage them to change and bathe if they noticed they were smelling. So, and then girls also mentioned that boys will lose concentration as well because they're so focused on girls' menstruation. So, and then a few other themes that came out were transactional sex, and just that, not that it's common, but that it exists. So, girls will seek out a boyfriend to pay for school fees and other items. Pregnancy is very much on the minds of girls in this area. They worry about becoming pregnant, and they also mentioned that a lot of girls drop out due to pregnancy, of school due to pregnancy. And then girls reported in the qualitative focus groups that they miss between 3 to 7 days of school due to menstruation because of not having something to control their periods. But we found it was quite different on the quantitative survey. Yep.
What are attitudes towards contraception in this area, and what's the
like condom
environment?
Yeah, condom use. It's Seventh-day Adventist.
Or birth control pills, or
I don't think birth control pills are available.
okay.
And then as far as the religion at Seventh-day Adventist, condom use, I don't know. I don't think it's particularly high. I'm looking at Chelsea because she also did work in Kenya. So
Rural areas are different than urban.
yeah,
Probably
exactly.
looking like 50% probably.
Yeah, probably about 50%. I don't think it's particularly high, especially because the rate of pregnancy is high. Early pregnancy is like a girl becoming pregnant and dropping out of school is just a really common phenomenon. So, yeah.
I have a question on the boyfriends. Is this presumably like an older guy then? It's not a person in their school?
It's also, yeah, it can be an older, just somebody that's not at school. There's been a lot of anecdotes about teachers engaging in these transactional sex relationships with students. And then actually boys their age will also do it if they have a source of money. But usually you're thinking about an older man because they have to have pocket money. Yeah, there's been a pretty big problem with teachers. It's been in the news with teachers having sexual relations with their students, male teachers. The breakdown, demographic breakdown of my quantitative results were that 170 girls used commercial sanitary pads, while 267 used others, so it's about 1/3 to 2/3. And then I also found that girls using commercial sanitary pads were statistically significantly more likely to be sexually active, and that they were more likely to have pocket money, which isn't particularly surprising if they're using sanitary pads. Because they have to have means to purchase them. So, and what I found was that they first primarily get the pocket money from a relative, and then followed by a boyfriend. I think a job came after that. So, yeah.
Is this the breakdown? This one, does that other include nothing at all?
But it's only like, it's only about 2 people, 2 or 3 girls. You're using nothing.
So only 2 or 3 girls in your entire sample use nothing.
So we found that girls really didn't miss much school for any reason at all. So they're missing an average of 2.3 days, and that's across no matter what they're using. So if you break, that's 2.3 days per 2-month period, so about 1 day per month. And if you look, these are just when I broke it down into categories. So there was no difference really statistically significant. I guess a slight difference between girls using other commercial sanitary pads. You can see that commercial sanitary pads is a little bit higher. And then when I broke the other category down into reusable pads, many underwear, handmade items, and nothing, I found that just many underwear was the only major difference. They missed about 3.5 days, which was period. Yeah.
So sorry, was that self-reported?
It was, yeah, because the school attendance, the logs, from talking to community members and particularly a woman who worked with a school at Weiser, she said that they just weren't reliable, that somehow teachers receive benefits for the more people that are attending, students that are attending a greater number of days, so they'll just fill it in that they did attend even if they didn't. So yeah, that's like definitely a limitation to the study, is that it was self-report. So the biggest reason for girls dropping out of school, as I said before, is pregnancy, and then followed by an inability to pay school fees, which is interesting because there is this policy of free primary education. And then very few reported that they dropped out because they missed too many classes due to menstruation. So, and then this is of course, the major finding, the relationship that I was most interested in between commercial sanitary pad use and school attendance. I actually found that girls using sanitary pads missed more school than girls who didn't use them. So, and that's when I dichotomized it as 1 or more days of school or 0. So when I dichotomized at 3 and 5 days, I found that the relationship still held but wasn't statistically significant, which would mean that there's really no difference between what girls are using and the amount of school they're missing. So, and then I also looked at girls using other items than just by the particular item they were using, and compared it to commercial sanitary pads, and I found that there was no difference in those. But when they're put all together, there is. So, and then we also found that girls using other items to control their menstruation actually were more likely to have vaginal infections than girls using commercial sanitary pads, which was consistent with my hypothesis, but it wasn't a statistically significant finding, yet I didn't have enough power to detect a difference when I looked at the particular prevalences that I found. So it might be that there actually is a significant difference between the two groups. So as I said, my original hypothesis was contradicted, that girls using commercial sanitary pads don't miss as much school as girls who are using other items. However, I don't believe that the relationship is causal. So I don't think it's that girls, the use of sanitary pads is actually causing girls to miss school, which I think all of you could agree with. So instead, I think that there are some unexplored variables, some residual confounders that I didn't measure that are actually causing an association between sanitary pad use and school attendance and missing school. So this is just a picture of a menstrual cramp. That's one of the residual confounders that I think might be playing a part, is pain during menstruation. So why do girls using commercial sanitary pads miss more days of school? So that was kind of the question I had after I finished my data analysis. The first hypothesis that I could come up with is that girls who are using sanitary pads might have heavier flows and would be more inclined to use sanitary pads because they do have a heavy flow. In turn, having a period that has a heavy flow or a long duration is associated with menstrual cramps and significant pain during menstruation, and I think it might be pain that could be causing these girls to miss school. I didn't measure pain. I did ask girls who what was the greatest challenge they faced in dealing with their menstruation, and again, the #1 answer was pain. So, and then the other hypothesis, so I don't know, I don't feel it's as viable, is that girls who are using commercial sanitary pads are engaging in risky sexual behavior to obtain them, and that when they're doing this, it's known that girls in these relationships aren't able to negotiate safe sex practices, so they may be getting infections that are causing them to miss school, Or there's also a time element involved in trying to find a boyfriend and actually like having relations with this boyfriend, in which girls can be missing school as well.
Why do you feel it's less likely?
I don't know. I think maybe because I didn't feel that. Well, it could be likely, but I don't know if STIs would cause girls. I mean, I think in most women's cases it probably would cause you to miss school or not go to work. But
No, I'm
not sure.
Second, so
Yeah.
transactional sex.
I think, yeah. I guess from my survey, it was kind of more, the idea was around this idea of pain more than the transactional sex. But it could be that girls just don't want to talk about it that much. So,
Because there's a difference between those who get access to sanitary pads, which are people to pay for them or have
Right.
the resources already.
yeah.
What was you might have mentioned this earlier. So,
Yeah.
What was about the cost?
The cost, sanitary pads are unaffordable.
Do you know what the cost is?
The cost is about, I think it's 80 shillings per pack, which is about $1.
And they're buying them individually or in packets?
In packets of 3.
Okay.
Yeah. That's still, it's unaffordable. We didn't find we found that commercial sanitary pads lead, or is associated with missing more school. It seems that having commercial sanitary pads available would make the experience of a girl in school overall much more positive. And that was really what I took from my whole study, is that they do need pads. Again, the feelings that were mentioned, shame, embarrassment, loneliness, were very prevalent. And then this is also supported by previous literature done in Tanzania on the experience of girls menstruating, schoolgirls menstruating. Shame was the most common feeling that girls reported, both in that and in a study done in Kenya. So this is an advertisement for sanitary pads, so Always in Kenya. And I think it puts it in a really positive light, but how girls are constantly having to check for a menstrual leak and how that interrupts their day. So I think that's pretty good. I have to go. Sorry.
Do you want to turn the lights off, maybe, so we can see?
Sure.
We can do that.
The volume.
Where are you going? I check, on the bus I check, in the class I check, every hour I check, when I walk I check, I rest I check, I cover I check, I hide I check, every hour I check them always, check there's a gun, no check there's a gun, I stay, no check, eight, no check, eight, no check, up to. The bus in the class, I study, I walk, I play, I dance, no saints, no check. Eight, no check, eight, no check, up to 8 hours long. Eight, no check, up to 8 hours long. Always.
I really like the dancing. So after my study, there are some opportunities for future research, as well as some questions that remain. One of my questions is, what is it that makes girls using commercial sanitary pads different from those using other items? Is it pain? Is it engaging in transactional sex? And then I'm also interested in whether girls are missing lessons as compared to school days due to menstruation. So the main outcome variable that has been looked at so far in research is school days missed, but I think missing lessons is really just as important. So I think it might be an overlooked variable. And then I again found that girls are really struggling to deal with pain there, and so to have support mechanisms in place would be really valuable for these girls to know how to deal with menstrual pain. They were asking my focus groups, like, what do we do to do this? And one girl that was working with me said, well, get pain medication, but it's not available. So, and then, of course, to include a measure for pain in subsequent research. There are a few inconsistencies in the data, which were interesting. In my qualitative focus groups, girls mentioned that they were teased a lot by boys, but then when I asked them that in the survey, around 89% said that they were not teased by boys about their menstruation. And then also, girls during the focus group said they missed between 3 to 7 days of school per month due to menstruation. And we found that girls miss very little of school days per month due to menstruation. So I don't know what exactly is causing this, but it may be that when we asked head teachers to select girls for focus groups, they selected girls who have greater problems dealing with their menstruation. So there was some sort of selection bias.
Did you use the same girls for the surveys, or did you survey all?
Well, yeah, it was all random, so except for like when the teacher selected. So I don't know if they were also surveyed. But. And then as far as the limitations, I mentioned before that we didn't have enough statistical power to detect a difference in vaginal infections between girls using sanitary pads and girls using other items, so there actually may be a relationship there that I'm not seeing, or more of a relationship. And then, of course, school attendance data is self-report. And then the existence of residual confounders that I didn't measure for, namely pain. And then we also use logistic regression, which can the odds ratio that's reported through this type of regression can overestimate risk ratios. So it might be that my odds ratios are overestimating the relationship. And then something that's really interesting is that girls, we found that girls really aren't missing that much school, and one of the reasons I think that it might be that they're not missing school is because if they stay in school, they have this opportunity to go to a free secondary school. They all know that. In the focus groups, when I said what are the positives of being a woman in the Hoover Bay, the only answer that they said was Weiser, which is this free secondary school, and the chance to go to Weiser. So I think it might be that they're staying in school in order to have the chance to go, which is really pretty exciting. For the possibility of keeping girls in school in other areas, creating these free secondary schools as a way to keep girls in school. So, and then just acknowledgments, of course, to my defense team, my mentor, Cheryl Groverman, Eve Puffer, who helped me a lot with setting up my research. And then Sam H. Schwenko, who helped me with my data analysis, as well as Joel Hillerden, Ryan Henson, Emily, and Amy. Weiser for housing me. All the women that I worked with in the Hoover Bay, who literally the research wouldn't have been possible without them. And then Duke undergraduates that I worked with, the Duke Global Health Institute, other members of my cohort who were very supportive, and of course my family and friends. So, thank you. Questions about it? Yeah, go ahead.
I was wondering if you knew anything, or you don't know about
Yeah.
this, but do you think that if you educated the boys about menstruation, then they would be less likely
Yeah.
to tease?
I think
Or,
so.
are they taught about menstruation, the boys at all?
No, girls neither are taught about it. So yeah, I definitely think that. I think boys are kind of the key in this picture to everything. And also just women aren't treated well in Manure Bay, which isn't surprising, but I think it has to come really through boys. And there's also like kind of resentment towards all this research being done on girls in the area. The boys are like, well, why aren't you researching me? So, but I do think that makes a difference. So I think that's like an important area to focus on is the boys also and their development. Yeah.
So you said that pads were 80 shillings for free, but are they readily available if people have money, or do they have to go travel and get them?
They're little kiosks. And so Mahuru Bay has this kind of, it's called Customs. It's the market area, and it's just a row of shacks, basically. And there's, I wish I had a picture. It's a farm. They have little pharmacies where you can buy them. I think they come from the local. They bring them in on trucks from the local. The closest big town is Magori, which is about an hour away on this really rustic pothole road. It's horrible, unpaved. So, but they do have access. Yeah. Yep.
I don't know if you looked at this, but you mentioned the different dropout rates at primary and secondary. And did you get the sense that survey results were different over the age?
Over the age group?
Yeah, or
I didn't like look at it. I'm trying to think of my focus group. I mean, I think, what was the average age of? I think the average age of first having sex was 13. So as you get maybe higher, I mean, that's really the biggest factor, pregnancy, for dropping out. So probably as you're getting higher in age, you're going to see more girls dropping out than the younger. I don't know if that younger girls, if that helps answer your question. Not really. But, yeah. Any other questions?
I just want to say it was really interesting.
Thanks.
You did a really good job. I was
Thanks.
just like totally motivated by it.
Yeah, I know. I wish, I mean, one of the drawbacks is that I didn't have enough time to do like an actual like trial, randomized like evaluation where I was distributing pads to girls, which I would have really liked to do, but it required about a year. So yeah, this was a little bit different just because of the time that I had.
So did you, were you taking classes this semester, or did you finish, like, how long were you in Kenya?
So I was in Kenya for 11 weeks, and I actually only had about 3 weeks to do my research. So that's a good thing for the cohort below me to know. I say younger cohort, the young ones, to know is that get your IRB in really early. Mine actually, I definitely got in a little bit later, but it wasn't really my fault. It sat on somebody's desk for 2 months because of a kind of a conflict of interest between the person who submitted it on my behalf and the institution that was reviewing it. So I actually had to go to Nairobi and stay with my good friend Chelsea and get it passed.
Hang out? Or?
Yeah, for a week. Yeah. And then get it passed, and then I went back and I had about 3 weeks to finish my research. So,
what was the 11 weeks of time like? Doing like?
I trained women for a while, and then I had probably about a week where I just volunteered. It takes a while to set everything up in a community when you're doing research, and really to form relationships. I had to get to know the head teachers of all the schools, and then just to find women who would work for me. But so yeah, and then this semester I took 1 class and then just wrote my thesis. Yeah. Any other questions from the cohort? Research.
Awesome job, Amy.
Thanks. Yeah, I appreciate it.
I'm sure we'll have more questions. Well, I have questions.
Okay.
What survey software did you use for qualitative?
I didn't. So, yeah. So, yeah.
I didn't do that.
Chelsea had the same. Yeah, I came back.
Just list the themes by eye. Go to Target, buy some highlighters.
Yeah.
I don't know if I'd recommend it. Like Andrea,
She did
go to
in
her,
Vivo.
she is in
Yeah.
Vivo, so it's kind of like
Yeah. No.
But it's kind of what kind of data you have, how much data you have, what you're looking for, and what you want your data to give you at the end of the day. So,
Did you record your focus groups?
I didn't. So we took really detailed notes. And then I took down a few quotes word for word that I thought I heard, and I was just like, whew. So, but no, I didn't, because we were talking about menstruation and sex, and I didn't want the girls to feel uncomfortable. If I had to do it again, I probably would, although it does take a lot of time to transcribe those recordings. But yeah, I think you all have had training in qualitative methods, but we didn't have much. So it really was kind of after I did the whole focus groups when I had to figure out how I was going to analyze it. So
They were in English, though? You took them all in English?
I did in English, yeah.
Did you pay the, like, 3
Well, we did it in English and Duluth. It was translated. What's that?
Did you pay the 3 Duke undergrads for helping you, or were they there?
I
for
didn't.
DGHI?
They were doing, it was very fortuitous for me. They were actually doing the, what is it called? Duke Engage program. They're Duke Engage students. So it was difficult, like managing 9 women plus 3
you were like
Duke
lucky
students.
to have.
Yeah, I was
Your
very
survey
lucky.
size was
Yeah.
awesome. Like, wow.
Yeah, I think that it's hard because like their expectations for what they wanted to do were they wanted to do research, which I totally understood, and I really wanted them to do it, but yet the surveys were conducted in Duluth, so I couldn't even interview the girls. So they had to do a lot of data, putting the data into Excel entry. That's not too much fun, but. So I was very thankful to have them, but
Yeah.
So, but yeah, I think field work really becomes, at least in my experience, it was the biggest thing was just logistics and knowing and learning how to manage people.
Right.
Especially with a team, I think it might be. Well, I think it was logistics probably even for those who didn't have research assistants. In a developing country, it's quite difficult. Yeah. Well, thanks again for coming. I really appreciate it.